Welcome, colleagues. We are happy that you're here, and we hope that you are focusing on the last few weeks in the semester. We wanted to take some time to go over some key elements when you think about quality improvement to make sure you stay focused as you're moving forward on your journey towards CNE, CNE Clinical, or CNE Novice. Our mission here at Dr. Sellars Educate is simple. It is to support all nurse educators to achieve excellence in the classroom, including achieving certification. If this is the first time that you are tuning into our channel, welcome. We are glad that you're here. And if you're returning, welcome back. We're delighted that you are here as well. I want to point out just a few elements of technology that I am using. We know that our students are more than 40% more likely to be engaged in content when we integrate technology. The reality is we all like to be entertained, especially when we are sitting for long periods of time. All right, so what you see me using right now is Prezi, P-R-E-Z-I, and this is the background that I'm using, if you will. This is where you see the sliding elements. Welcome colleagues is what we started with. And then you can add content to the actual slides in Prezi. And then I'm using Zoom to record our session today. Sometimes I use Loom, sometimes I use Zoom, sometimes I use Prezi, but just play around with the different technologies to see what you like. And then the third resource that I'm using and really engaging activity is music in the background. Now that was a track that is available on Zoom. It's called Zoomtopia. It's an app. You're able now to access different apps on Zoom based on your level of subscription that you have with Zoom. But check it out. I would say just try out some of the apps. I really enjoy using the timer app as well when it comes to breakout rooms. You know, we want to stay focused and keeping our time because that's how we demonstrate respect to our students in the classroom. All right, so those are just some elements of technology that I wanted to share with you all. And I'm also going to be going back and forth looking at a couple of slides that I want to make sure that you all are focusing on as you move forward on your journey, to include some websites as well. So nln.org, I want to go there just to show you a few elements that I want to make sure you focus on there as well. We always like to start though with our thought-provoking questions. So let's start there. This is Snapshot 151, where we're focusing on quality matters, not the certification, not the credential, but this is simply focusing on the importance of us engaging in continuous quality improvement. Why is it so important? What is the impact that we can have in our classrooms when we embrace this important step? So let's take a look at our thought-provoking question, and then we'll go into our content. As we seek to obtain suggestions to improve course quality, nurse educators seek feedback in a variety of ways. What strategies should be used for online learning environments? A, course evaluations from in-person learners to ensure alignment with the curriculum. B, peer review by nurse educators that teach in the in-person setting to ensure consistency. Or C, invite colleagues outside of nursing with online teaching experience for peer review. All right, so I want you to do two things, just like we always do when we get to a question on the CNE exam. Number one, I want you to ask yourself, what is this question actually asking me? And then number two, I want you to think about what is it that I know for sure about content related to this question. Okay, so every question you get to on the CNE exam, those are going to be the two questions that you ask yourself. Remember that we use the term CNE exam as a generic sense. We're actually referring to all three exams, okay? So that's our thought-provoking question, and go ahead and take some time if you haven't already. I want you to print out the study worksheet, okay? That's right here in the description of this snapshot. And then I also want you to go ahead and write down today's date, okay? Whatever date you're watching this snapshot, I want you to write down that date, and then I want you to write down an objective. So what is it that you want to take away with you today? Maybe it's just identifying 2 teaching strategies that you want to use in the classroom. Hopefully, if that's a goal that you have, you've already checked the box in that area. Or maybe it is to close your knowledge gaps related to a specific concept. Maybe that is a little fuzzy for you. All right, so let's go ahead and take a look at the NLN website. All right, so that's where we're going to go first. If you haven't been there already, I want you to take some time to go there, nln.org. There's a couple of resources you can take some time to look around. The summit is coming up. I'll go back to the homepage. Highly encourage you to attend the summit every single year, but especially this year. They are going to be talking about competency-based education with a pioneer in CBE. We also at the Grandover are going to have a pre-session on competency-based education. And it's ironic that NLN chose to engage in this really important topic as a primary focus for the summit. And we did as well. We planned our workshop, our masterclass, more than 4 months ago. So I think that there's just strong alignment between the focus that we have based on the literature that's coming out and the focus that NLN has as well. The first place I want you to go is going to be NLN certification right here at the top. And then depending on the exam that you're choosing to take, you can select whichever one is most appropriate for you. For the CNE exam and for any of the exam, whichever one you choose, I want you to just go through each of these resources that are listed here. You will notice that there is an option for a self-assessment exam. If you've been on the journey with us, you've heard us talk about the SAE. For some colleagues, it's very helpful. For others, not so much. NLN is very clear, though, that there is no guaranteed relationship correlation between how you do on the practice exam, the practice test, the SAE, and how you actually score on the certification exam. You can see that that is in bold. All right, so the next resource that we want you to take a look at on the website is going to be the candidate handbook. All right, so we went ahead and downloaded the PDF so we could refer to it in our time together. And if this information is something that you're already aware of, just bear with us. We want to make sure all of our colleagues are on the same page as we walk through each step in the process that you're moving forward with on your journey. All right, so what we want to do is to align the content that we're talking about today. That's a really important step. This is going to help ensure that you, as you're listening to this content, that you start out from the very beginning with intention, being very intentional about the competency that you're focusing on and the content that you are going to use to help bridge your theory practice gap. We are more than 90% more likely to retain information when we have a chance to do two things: practice it or implement it or apply it, and when we're able to actually teach it in a reasonable time between when we learn about a skill, a strategy, and when we actually execute. This is going to also allow us to increase our likelihood to be successful on the CNE exam. There are going to be 70 to 80% of the questions, depending on the exam you're taking, at that Bloom's taxonomy level of application and analysis, just like the NCLEX with NextGen. We know that was a big focus for NCSBN. And NLN also feels very strongly that it's not enough just for us to memorize concepts. We have to be able to apply them and analyze them. All right, so back to the detailed test blueprint in the candidate handbook. You will see that it's competency 6 for the CNE exam. And then as you take a look at the novice exam, it's competency 6 as well. And then for CNE clinical, there are different elements related to continuous improvement throughout all 6 competencies, but we want you to focus on competency 6 as well. So it's ironic that all the competencies or the competency numbers are the same as we explore ways that we can improve the learning experience for our students. We know that's what it's all about. And as we think about what our next steps are going to be, let's go back and take a look at our content for our time together. Now, when you are spending time identifying what your study plan is going to be, we want you to make sure you do 2 things. Okay, so first and foremost is pull out that 7-week study plan. Okay, so if you haven't started with that study plan, we want you to start today. The best time to start was yesterday. The second best time to start is today. Okay, now that 7-week study plan you can find on our website. You can also find it in this study workbook. I wanted to start out by talking a little bit about, my slides are moving faster than I want them to, the experiences that you can see this educator assumingly is having. All right, so you can see that she's showing some signs of frustration. We also see a clock, right? So for purposes of the relationship between the expression of the person that we're seeing here and our experience on this journey, or maybe even your experience. All right, so this is all about you and what your priorities should be as you're moving forward. I want you to know that time is our most valuable asset. Our goal is to help you compress time by being more effective with the hours that you are spending focusing on content. All right, so I want to point out a couple of other things. You see the resource that is in her hand. All right, so you can see that's a tablet. You also see paper, and you see something to keep her hydrated. This is what we want you to focus on as you're thinking about your 7-week study plan. We want you to have the right resources. And there are only two, okay, from a textbook standpoint. That's going to be Dr. Billings and Halstead Teaching and Nursing right now. The questions on the NLN exams are aligned with the 6th edition as of 2024. And then we want you using Dr. Caputi's CNE review book or Dr. Teresa Schallenberger's CNE-CL review book, okay? These are great Cliff Notes versions is what I like to call them to help you stay focused and maximize your time. You don't want to spend, like I did, 7 years preparing for the exam. The major deterrent and really what got me off track was I didn't have consistent support. I didn't know what resources to use. And thankfully, you all don't have to go through that struggle. So just think about how you're most effectively using your time. Now, this is a goal, right? We all want to see our students cross this finish line. This is the pinning ceremony that I attended last year at a university in Virginia, and I really enjoyed pinning. I think it's one of the most special and really sacred times for nursing students and for us as faculty too, because we get to reflect on our why. So as you're thinking about where you are on your journey, don't forget about your why. Professor Handy is one of our colleagues that was most recently successful on the exam. And what she said was really impactful, and it really aligns with our mission. She says that we provided tools to help her be successful in 60 days, but we also provided a clear path to success. Listen, we don't have time to waste. We don't have time to add one more thing to our to-do list or to stretch out our to-do list. So our goal is that you are focusing on either CNE in 60 days or 7 weeks, depending on where you are on your journey. All right, so let's keep going through the content. Focusing on quality matters, I want you to think about a couple of resources. I want you to think about this thought-provoking question. If you haven't had a chance to review it, or if you're not sure exactly what that means for you, that's okay. All right, so we'll come back to that at the end of our time together. We wanted to use this Kaizen model because it so elegantly describes every single step that we want to consider when we are thinking about not only a continuous improvement plan for our curriculum, but also for ourselves. What should our journey for quality improvement and this continuous cycle of improvement of our teaching strategies look like for us? We know our students benefit when we engage in lifelong learning, when we commit to nurse educator excellence. So first step is to identify opportunities. It's so ironic because I was just sharing with colleagues on Friday, I did a follow-up with them related to how we should engage with our clinicians on the front line and reminding them about the importance of SBAR and the NCSB and clinical judgment model, how we have to make it a seamless process. In order for us to communicate effectively, we have to be able to recognize those cues as an example. And then we have to be able to identify and really advocate what our patients' needs are. All right, so thinking about identifying the opportunities, what is your opportunity today when it comes to closing your knowledge gaps? And then the next step you want to think about is you want to plan and prioritize and standardize, right? So planning out what is your 7-week study plan? And then using standardization to ensure that you are using the right resources. Next is you want to think about, now that you have a plan, now that you've identified your resources, it's time to implement, right? We want to implement those changes. We want to revise our curriculum if we need to. What does NLN say about continuous quality improvement? Well, it's so important that they adopted it as a hallmark of excellence. This is one of the boxes on our checklist that we should ensure that we have implemented in our nursing programs as a seamless process. We want to gather that feedback from our internal and external stakeholders and our, I like to say, our colleagues that have true skin in the game and looking at the influence of outcomes associated with our nursing program. As an example, we know that our healthcare partners certainly have skin in the game, right? Because if we are not able to graduate practice-ready nurses or nurses that feel equipped with the competencies to provide safe patient care and make those safe patient care decisions, then the healthcare setting will be negatively impacted. And more importantly, our patients will not receive the care that they deserve. All right, so just thinking about not only how we implement that, but how do we sustain that over time? So it is a hardwired practice. We want to measure and evaluate, right? And then we standardize and repeat. We make those changes. Knowing that we only have a finite period of time allows us to focus on and really prioritize what we need to as it relates to making changes to our curriculum, identifying what is the most important quality measure for us to consider depending on where we are in our nursing program. And we know it also depends on accreditation or priorities with our NCLEX pass rate as an example. But whatever that priority needs to be for you as it relates to time, make the most of it. That is why you want to follow a 7-week study plan using CNE in 60 days as a framework to ensure that you are maximizing the time that you have in focusing on concepts or even the nursing program elements that are going to move the needle and have the biggest impact to improve the learning experience. For our thought-provoking question, if you chose C, you are correct. I'm interested in seeing in the chat, so if you all are watching this live, go ahead and put in the chat what you chose as your option. And if you can think about the rationale, what made sense when you read the question and maybe what doesn't make sense now, I'm always delighted to see the feedback. Page 434 in Billings and Halstead is going to be the reference if you did not choose the correct answer. And even if you did, I just want you to take some time to look at those pages. It actually carries over into 435, but it'll give you some additional context related to this thought-provoking question. We hope that this snapshot has been helpful. We want you to stay encouraged. Okay, so we're sharing a testimonial from Dion. She says, I used Dr. Sellars Educate to study for the CNE exam, and I was successful. Dr. Sellars Educate gave me structure and the discipline I needed to stay focused and work on improving my gap areas. I would strongly recommend Dr. Sellars Educate for anyone on the journey to become the next certified nurse educator. Thank you, Dr. Sellars. I don't think I could have done it without your service. Well, that is our service guarantee. We are here to support you until you are successful, no matter how long it takes. I have had some questions about this toss ball, I like to call it. So I did go ahead and put that in the description as well. It's a great icebreaker. I use it all the time, whether I'm in the room with students or colleagues that we're supporting across the country, or even some local activities that we have engaged in. We've used this toss ball, and what you do is, it's so funny because I used to create my own toss ball using a beach ball when I was teaching in person. But basically, you toss it to someone across the room, and wherever the right thumb lands, as an example, is the question that they would respond to. So think about it as a way to engage your students, whether it's this toss ball or if you make one yourself from a beach ball. Reach out to us if you have any questions, info@drsellarseducate.com. Until next time, we hope you have a great one, everybody. Take care. Bye-bye.